Hi friends, this is Jennen. I'm coming back with your requests. Several people has come up to me and they've requested a second blog, and I wanted to apologize profusely for not coming out with this sooner. I know it's been 2 months since my last blog. I apologize a lot for that. It's just a lot has been going on. And I've been extremely tired. In addition to everything that's going on with me, I'm also anemic, which basically means I don't produce enough red blood cells. And that causes me to feel extremely tired, extremely drained. So I've been spending a lot of time in bed. And, I have to force to get up sometimes to do what I need to do, go to work and doctor's appointments, etc. So I apologize for not coming back at you sooner. But I do thank you very much for your patience and for you just, sticking by me and inquiring with me how I'm doing and asking me how's my health and inquiring about my daughter and my family. And I really do appreciate that. And I thank you so much from the bottom of my heart for just being patient. So here it is, the second blog, finally. And I'm happy I get to do this. I won't even tell you what time in the morning it is right now because I had to, take a little nap. But I am back and I'm doing this for you. When I left off back in January, I told you about the difference between peritoneal dialysis and hemodialysis, and that is still up on my page as well. You can check that out on my YouTube page. But today, I just want to share some good news with you. You may or may not know already, but surgery has been set, so I will be getting a kidney transplant. Yay! On the 27th of March. So mark your calendars. That'll be a big day for myself and my angel donor, Christy Nolan. And so that has been, cemented, and we are so looking forward to that. Like, everybody is just ecstatic, and we're all looking forward to the big day. That's less than 2 weeks now. Another thing that happened within my little mini time off, I had my hemodialysis line removed. Now, from my last blog, I showed you my hemodialysis line was in my neck, at the top of my chest. So they removed that, which I was really excited for. So I do not have a hemo line anymore. So my videographer, Tatiana, who's recording right now, she's gonna show you, if you're ready for this. It's a scar, and it's not necessarily the cutest looking scar, but it's my scar. It's my scar. It shows what I've been through, and I'm proud of my scar. So I'm going to give you a little quick peek as to what my hemodialysis scar looks like. So you can zoom in a little bit. That's where my hemodialysis line was, and now it's healing up, and it's coming along nicely. So that's what my scar looks like. So no more hemodialysis line. So I'm excited about that. Next will be my peritoneal dialysis line, which is in my lower stomach area that I was telling you about before. That's going to be removed. Can't show you that right now because it ain't cute right now, but I will show it to you. You will see that in my next blog. I don't know if I said that in my last blog, but I promise I will show you my next blog when it looks a little bit cuter. I'll show you what that looks like. In the meantime, what else? I had a lot of appointments. I met with a lot of doctors, and we've just basically went over what to expect during surgery, how long the procedure is going to be. It's going to be about 4 hours. They're going to take Christy in first, and they're going to do what they need to do with her. They're going to remove her kidney, and then they're going to bring me. They'll sterilize the room, and then they'll bring me in, and they will do an incision on the lower right hand side, and they will work their magic and put Christy's amazing kidney inside of me, and then I will feel like a brand new woman. That's it. We'll be in the hospital for about a week, and at that point, they'll send me home, but there's a lot of follow-up. I have to go back into the hospital, do blood work 3 times a week. I have to meet with different doctors, and I have to meet with pharmacists and make sure my meds are working the way that should be. If it's not, they'll adjust it so it would work for me. It's just a lot of follow-up and recovery. They say it's about 2 months for recovery, but everybody recovers differently, so it might be 2 months, might be 2.5 months. It could be even a month and a half. We'll only find out when the time comes. So it's a lot of information, a lot of excitement on this end. So I'm happy to share this news with you. And what else is going on? I'm trying to take the people that came forward to help me and try to be a donor for me. Since I already have my match, I'm now taking those donors, those people who are willing to donate their kidney to me, and I'm pairing them up with other kidney dialysis patients. There's a beautiful little girl that I'm trying to help out with giving her a kidney through a donor, a living donor, and she's currently in Sick Kids Hospital, so I'm helping her. There's an amazing guy, his name is Victor, that I'm trying to help him out as well. There's another gentleman by the name of Gerard that I'm trying to help out. So it's just the love just being spread around and sharing the love and just sharing the wealth. You know, we have that ability to give, and it's absolutely necessary to give. Become a living donor. It's important. It's extremely important. Literally, someone's life depends on this. So that's what I'm doing. I'm sharing the wealth. And if you check out my Facebook page, there's also a GoFundMe page set up for my donor, Christy. That page is set up for her because she's a yoga instructor, an excellent yoga instructor. And while she's off recovering from donating her organ to me, she's going to need, funds to help pay the rent, groceries, etc. So there's a GoFundMe page set up. You can reach that page through my Facebook page and just donate, or you could just go on GoFundMe and just search her name, Christy with a C, Nolan, and you'll be able to donate to her. You can donate whatever you can because every little bit counts. It's all about the year of giving. We need to give back. We can't just, be selfish and just keep all the wealth to ourselves. We need to give back. So whatever you can give, that'll be greatly appreciated. What else is going on at this point? That's the only thing I can think of at this point in time. My next blog, which I promise will be a lot sooner than 2 months, you'll get to see my daughter, Tatiana. You'll be able to see her. She's going to talk to you about her experiences, just how she, helps me out, and she'll be discussing what she's experienced, how she felt through this whole process, and you're gonna, see from my 12-year-old daughter's point of view through her eyes. So that's something that you can look forward to as well, because I know a lot of people have been asking about her and inquiring about her as well. And I'll also have some pictures from our meet and greet. My family and Christy's family are going to be meeting for the first time, and I'm going to have some pictures and some videos of that, so I'll be able to share that with you as well. And some other little tidbits in there as well that's going to be happening. So stay tuned. There's a lot of information coming up, and I'm sure you'll enjoy what you'll see. And if you have any questions, of course, you can hit me up through my Facebook page, reach me through my YouTube page, and I will definitely respond as soon as possible. Thank you very much for sticking with me. Thank you for inquiring. Thank you for the love. Thank you for the support. Thank you for everything. Greatly appreciated. And as I always say, this too shall pass. And thank you. Have a great day.